Today's lecture is entitled The Nervous System. My name is Carlos Andres Suarez-Quian, and I am the creator and narrator of this lecture. I could have easily added the subtitle, The Elevator Speech on the Nervous System. As you may know, this subtitle refers to the advice that everyone should have a 30-second introduction about themselves ready to go for when you meet that important person in an elevator. I feel that way about the nervous system. Scientists have spent lifetimes studying the system, and the amount of material one must master to become a neuroscientist is daunting. It truly requires years of study to fully learn about the brain and the spinal cord functions. Hence, for this lecture, I will limit myself to discussing the essential information every beginning student should know to then begin the study of neuroscience. The objectives of this lecture include the following: present the main functions of the nervous system, discuss the main divisions of the nervous system, describe the essential components of the nervous tissue, define a nerve, especially its structural components, and finally, present a focused description of the neuronal organization of the nervous system. Let's begin. I start my lecture by presenting a bear in the woods. If you ask yourself, do I see the bear in the woods? And what to do if I see a bear in the woods? You have basically described the functions of the nervous system. The first question is describing sensory input into the nervous system, sight, one of the 5 bodily senses. It could have been touch, smell, hearing, albeit taste might have been a bit difficult to sense. Indeed, the nervous system is built to receive input, then integrate the input. Once integrated, the nervous system directs a motor output or efferent effect. That is, what are you going to do after seeing that bear? Finally, while all this is going on, your body is also monitoring bodily functions, both outside and inside the body. Your body is increasing your breathing rate. Your heart is starting to pump faster for the increased blood requirements your muscles will need to either run away from the bear or, worst case scenario, fight it. This is what our nervous system does. The question now becomes, where's all this input and output being received, integrated, and sent back out? We can describe the nervous system in one of 2 ways. First, as shown here, we describe the nervous system in topographical fashion. That is, where are the structures located? Globally, the nervous system is classified into the central nervous system, consisting of the brain and the spinal cord that are now labeled. It is where afferent input comes in, is integrated, then efferent output exits to stimulate muscles and glands. The rest of the nervous system is considered to be the peripheral nervous system. It is made up of numerous nerves that capture the incoming information, the sensory neurons, and nerves that travel to the periphery with motor output, the efferent neurons. The nervous system can also be described in terms of function. Shown here again is the brain and spinal cord, comprising the central nervous system. But now, let's describe the peripheral nervous system in more detail. I start by describing the sensory or afferent input. This input needs to be of 2 types: from the body, that is, when we touch something hot and we feel our hands burning, and this input will be called somatic. The second type of input is what our central nervous system senses from our organs. We may not be conscious of these inputs, except in a general sense. For example, do we feel ill? And this type of input will be labeled autonomic or visceral sensation. To carry out an action, we need output, and this function will be referred to as motor or efferent activity. As before, we need to send motor output to both the body, somatic, and this will represent the voluntary control of our muscles, as well as the viscera or autonomic involuntary output. This latter represents the signals our central nervous system sends to our organs. For example, the heart to speed up or to either fight or run away from the bear. The motor output will target effectors. Skeletal muscles are those we will use to fight or run away from the bear. Hence, they represent voluntary effectors, whereas heart, smooth muscles, and glands are considered involuntary. The heart will beat on its own without you having to tell it to beat. And note, the autonomic motor output is of two types. Sympathetic output is deployed when we fight or flight, i.e., again, think of the bear in the woods. Parasympathetic output is for rest and repose, i.e., for happy hour celebration if you defeat the bear or run away from it. Having described the functional classification of the nervous system, the peripheral nervous system is further split into 7 functional classifications as follows. First, as we mentioned previously, the PNS is broadly divided into sensory and motor divisions. Next, the broad divisions are further characterized. Let's do the sensory division first. There is general somatic sensory and special somatic sensory. There is also general visceral sensory and special visceral sensory. You can stop the tape and read what each of the 4 sensory divisions entails. For general somatic motor, there's only one division. For visceral motor, there are 2 types of divisions, general and special. As to why these 7 classifications, this is a field of study in itself. It has to do with development, pharmacology, and physiology of nerves that perform these types of functions. Suffices to say that in an introductory lecture, students should be aware that nerves are complicated. Their functions are even more so, but it is possible to organize them into systems in which information gained from one set of nerves can be applied to how other nerves within that system function. Let me now mention the structures that perform the functions of the nervous system, the cells, known as the neurons. We cannot see these neurons with the naked eye, and hence, they're not generally the source of focus in gross anatomy, but beginning students should be aware of their presence in the nervous system. And these neurons are of 3 types. They can be multipolar, pseudo-unipolar, and bipolar. In general, the neurons will exhibit a receiving set of projections known as dendrites. All will have a nucleus or cell soma, and then projections will exit that are known as axons. The multipolar neurons are found in the brain and the spinal cord and are the most common types of neurons. The pseudo-unipolar are found in the peripheral nervous system and are always sensory. Finally, the bipolar are quite specialized and are located in areas of the central nervous system responsible for the senses of sight, hearing, and smell. Let's look now how the impulses of input and output travel in these cell types. In the multipolar neurons, The impulse travels from the dendrites to the cell body, continuing onto the axon in one direction. In the pseudo-unipolar cell, the impulse also travels from the dendrites to the axon, although note that while the transfer of the impulse is functionally the same as that of the bipolar neuron, anatomically there really is only one projection arising from the cell soma. This is the reason for the name of the neuron. In bipolar neurons, one arm conducts towards the cell body, the other away from it. The processes are morphologically identical, but functionally quite different. We can also define the neurons in terms of their functional classification. Here, I show a cross-section of the spinal cord and label the dorsal and ventral sides of the cord, the terminology used when the cord is in the anatomical position, that is, when someone is standing up. The input signal into the spinal cord will travel via a sensory neuron, and as shown in the previous slide, these neurons are pseudo-unipolar. The output signal will exit the spinal cord via a motor neuron, which you can see now is a multipolar neuron. Connecting the two signals are interneurons, and yes, these are also multipolar types of neurons. Before moving on from this image, look again and realize where the cell bodies of sensory and motor neurons are located. The cell bodies of both motor and interneurons are found within the cord itself. The cell bodies of sensory neurons reside outside the cord. Neurons are not the only cell types found in the nervous system. Supporting cells, called neuroglia, are also present and numerous. Here, I again show a motor and sensory neuron of the peripheral nervous system, but now demonstrate the supporting cell surrounding the axons. The neuroglia present here is termed a Schwann cell, and it surrounds the axons with myelin. They help speed up the impulse traveling through the axons. The neuroglial cells are not trivial in maintaining the function of the nervous system. In fact, glial cells in the brain can become cancerous, and the condition is known as glioblastoma, one of the cancers for which there are no known cures. Life expectancy of a stage 4 glioblastoma is generally no more than 14 months. Recent well-known politicians, for example, John McCain and Ted Kennedy, died from glioblastoma. Loss of the myelin sheaths in peripheral nerves is associated with the most painful condition known to man, and is called tic douloureux, or trigeminal nerve neuralgia, first described at the end of the 1st century. And loss of the glial cells is believed to be indicative of multiple sclerosis. Hence, it is clear that these cells are important and are now under significant investigation. So if we cannot see neurons and glial cells with our naked eyes, what is it that we see when we dissect and find these long string-like structures that are specifically not vessels? These are called nerves, and they're the ones made up of the neurons and neuroglial cells just described. Let's go inside a nerve and provide some description of how it is composed. What we actually see on the outside of a nerve is termed the epineurium, a dense connective tissue layer that protects and cushions the inside of the nerve. Inside the nerve, there can be several compartments termed fascicles. They too are bounded by connective tissue, and within the fascicles are found the nerve fibers, also surrounded by connective tissue, termed the endoneurium. It is the nerve fiber that contains the axon and myelin sheath just described for a neuron, and these nerve fibers can be either motor or sensory. I repeat, The nerve fibers can be either motor or sensory. Saying it another way, fascicles consist of diverse modalities. Clearly, nerves are highly complex structures. Learning their names in gross anatomy is just the beginning. At this point, we can delve deeper into the nervous system and describe the players that comprise a complete reflex arc. From the time an input is received, it will be captured by a receptor, travel to a sensory neuron that is pseudo-unipolar, enter the central nervous system. Here it is the spinal cord, where the input will be integrated. Then an output will be sent via a motor neuron, a multipolar type of neuron, and ultimately reach an effector organ. This is precisely what is happening when we see that wild bear in the woods. The receptor is in our eyes, the retina, but the same pathway occurs when we prick our finger with a pin or touch a hot stove. This is what's termed the pathway of the reflex arc. Let's look more closely at the reflex arc and distinguish between two types. Shown in the image is a cross-section of a spinal cord. On the left are two lower limbs, and on the right, two upper limbs. Let's first describe the monosynaptic reflex arc that you're familiar with. Based on the scheme presented in the previous slide, a rubber hammer hits your knee tendon, and this blow is felt by stretch receptors on your thigh muscles. The input is delivered by sensory neurons to the spinal cord, where it travels to a motor neuron and is distributed to an effector organ that makes you kick your leg. In this type of reflex arc, we have no control over it. Every time the patellar tendon is hit, we will kick our legs. It is considered an involuntary reflex. The other type of reflex is known as a polysynaptic reflex. It too is involuntary and follows a pathway described for the monosynaptic reflex, except that there is an interneuron present in the pathway between input and output that makes these two types of reflex slower than the monosynaptic types. Once the output reaches the motor neuron, the steps are once again identical to the monosynaptic reflexes. If you're wondering why we have reflexes, it is because most reflexes protect the body. Think of touching a hot plate with your finger. Testing of reflexes is part of a normal physical exam and elicits information of the patient's sensory and motor pathways to the limbs, especially after an injury. We have been discussing the peripheral nervous system, but now let me say a few words about the spinal cord, one of the components of the central nervous system. Shown here is a drawing of the spinal cord within the backbone as seen from the side, as well as a cord from an anterior view. The spinal cord extends from the foramen magnum to the vertebral level L1, L2. It contains 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. As you become more familiar with gross anatomy terms, these names for regions of the body will become part of your scientific vernacular. Also, if you look at an isolated spinal cord, there will be 2 enlargements, the cervical and lumbar. These enlargements represent nerve plexuses necessary for extensive control of the upper and lower limbs, respectively. As you can imagine, the spinal cord is vital to the life of a healthy individual. Consequently, there are certain levels of protection that shelter it. The first level is bone, the backbone as shown in the image. Let me now show you the spinal cord in a cross-section cradled by a vertebra. The cross-section of the spinal cord is apparent, and nerves can be seen to the side of the vertebra. Hence, realize that bone do protect the spinal cord, but peripheral nerves are pretty much devoid of this protection. But in addition to vertebra, membranes surrounding the spinal cord also provide considerable protection. Let me describe these now, the meninges, ancient Greek for membrane. Shown on the left is an isolated spinal cord still surrounded by its outer membrane, the dura mater, hard or protective mother in Latin. If you reflect the dura mater, the spinal cord becomes visible. But in addition, there should have been a second layer, the arachnoid mater. However, this second layer is not visible because it has dried out, and this layer has collapsed onto the cord. Let's go to the drawing and explain the meninges. The dura mater is now labeled and also reflected. Deep to the dura is the arachnoid mater, so called because it resembles a spider web. The last layer is known as the pia mater. It is not visible to the naked eye, but it is there. Indeed, if you ever see an isolated spinal cord, it will be surrounded by the pia. It is not possible to peel it away, as one can easily remove the first two layers. Combined, the three layers are known as the meninges. You may have been vaccinated prior to entering college against bacteria capable of attacking these layers and causing meningitis, inflammation of the meninges. The bacteria responsible for meningitis spreads when an infected person is living in close quarters with others. Think crowded dorm rooms. The last layer of protection is actually liquid, called cerebral spinal fluid, and resides deep to the arachnoid mater. You will see shortly how this fluid can be assessed based on the anatomy of the spinal cord and the meninges. The cerebral spinal fluid is produced in the ventricles of the brain, the area in blue in the image. It flows continuously through the subarachnoid space, also present in the brain. The entire central nervous system contains approximately 80 to 150 mils of CSF, and this can be tapped for analysis to see if one is suffering from meningitis. The CSF functions as mentioned previously for mechanical protection, that is, shock absorption for vigorous activity, and helps to float the brain. But as is now known, it will not protect the brain against continuous forceful blows to the head. Think of the current athletes who engage in contact sports and experience traumatic brain injuries. CSF also provides chemical protection. It creates the optimal environment for accurate neuronal signaling and aids with circulation. It will exchange nutrients and waste products between blood and nervous tissue. Yes, CSF is considered a vital component of the nervous system. Let's go back to the spinal cord now and focus on terminology for nerves. That is, the string-like structures we will encounter when dissecting or entering the body for surgery. Here again is a cross-section of the spinal cord, and labeled is the outer part, the white mater, and the inner part, the gray mater. These names arise from the appearance of the cord in fresh sections. The composition of the white mater is due to the presence of the myelin of the supporting cells surrounding the axons, whereas the gray is due to the presence of neuronal cell nuclei. The first thing I want to do here is orient you to how the terminology will be presented. Recall the anatomical position, where we distinguish between front and back by using the terms anterior and posterior. For the spinal cord, neurologists long ago used terms of direction for the spinal cord as present in quadrupeds. Hence, posterior is indicated by the P. It is known as dorsal for the spinal cord. Anterior, A, is known as ventral, or V. Right and left are used in the anatomical position. Moving back to the spinal cord, we can see a projection arising from the dorsal side of the cord. This is termed the dorsal root. On the ventral side, we see the ventral root. These two roots come together as a spinal nerve. These are the ones that form the 31 pairs of nerves arising from the spinal cord. Each spinal nerve will give rise to a dorsal and a ventral ramus. Rami is the plural. In addition, exiting from the spinal nerve and ventral ramus, one will find a white ramus and a gray ramus. It is here that we will find axons to the visceral system. If you now focus your attention to the dorsal root, you will see that only afferent fibers are present here. In contrast, in the ventral root, only efferent fibers will be present. In the gray and white rami, both sensory and motor axons are present. As to why the terminology has to be so confusing, roots, nerve, rami, as clinicians learned more about structure, it became clear that depending on where the lesion is on a nerve versus a root or rami, a patient can lose afferent sensation or motor activity for both somatic and visceral regions. Knowledge of structural composition allowed clinicians to make diagnoses of where the lesions resided long before imaging modalities were developed. As to where the dorsal and ventral rami travel, they have been mapped out in the body in a circumferential pattern, and they're called dermatomes. As shown in the image, from the front and the back, these are areas of skin innervated by the cutaneous branches from a single spinal nerve, and they're based on development of the fetus. You will learn more about this in embryology. All spinal nerves, except C1, participate in dermatomes. Most clinicians remember the term dermatome, but forget which represents what area of the body, except for a few listed here. It is not necessary to memorize these numbers for this course, but dermatomes do help to explain the specificity of how herpes zoster virus presents itself time and time again. Individuals who had chickenpox as youngsters can have a breakthrough expression of the herpes virus in the same dermatome in later life. The virus hides within the ganglia of a specific dermatome and under certain stimuli can express itself over and over and time again. There is now an effective vaccine to prevent the herpes zoster expression. Similar to the circumferential expression of spinal nerves as dermatomes, there are myotomes, defined as muscle groups innervated by single spinal nerve roots. Here, for example, I show the specific spinal nerve rami that innervate distinct muscles of the upper limb. The specifics of this innervation will be learned during the upper limb anatomy section of the course. Myotome testing is an essential part of neurological examination when suspecting radiculopathy. If you're wondering what radiculopathy is and why knowledge of myotomes is important, the answer is clear. Radiculopathy is commonly referred to as a pinched nerve, and it is an injury or damage to nerve roots in the area where they leave the spine. This condition can affect anyone and can be the result of a disc degeneration, disc herniation, or other trauma. In the last part of this lecture, let me show you some examples of how this information will allow you to understand the anatomical basis of pathology of the nervous system. Here, I show the appearance of a child with hydrocephalus, or water in the brain. How does this happen? Recall the cerebral spinal fluid and its protective abilities and the fact that it's constantly produced. If there's excessive accumulation in the ventricles of the brain, it can exert crushing pressure on the brain. The enlarged skull results because cranial bones have not yet fused and the CSF pushes the brain outwards. Treatment is to shunt the excess fluid into a vein in the neck, but the condition has to be diagnosed prior to the skull enlargement. Another condition that implicates the cerebral spinal fluid is known as normal pressure hydrocephalus. It tends to affect the elderly. Normal pressure hydrocephalus is a brain disorder in which excess CSF accumulates in the brain's ventricles, causing thinking and reasoning problems, difficulty walking, and loss of bladder control, but in which CSF pressure is not elevated. Treatment again is straightforward if recognized. A shunt is placed into a ventricle and the excess CSF removed to the abdominal cavity. Finally, now that you know the anatomy of the spinal cord, you can appreciate what structures need to be traversed when a spinal tap is performed and how an epidural anesthesia is administered. On the left is a drawing of the end of the spinal cord surrounded by the vertebral column. Where the cord ends, dorsal and ventral roots continue and are called the cauda equina, or horse's tail, based on its resemblance. The subarachnoid space where CSF is found is indicated in blue. The dorsal sac is indicated extending past where the cord ends. Now you can see where to insert a needle below the end of the spinal cord to withdraw CSF to assay for meningitis. CSF should come out clear. If it is cloudy, stay back. The bacteria are highly infectious. On the right, we now see an isolated spinal cord still encased in its dura mater. Recall the drawing of the meningeal layers. Epidural anesthesia is administered superficial to the dura mater, not below it. That is why it's called epidural anesthesia, superficial to the dura. The anesthetic fluid can diffuse and reach the respective rami that serve the uterus. The anesthetic will deaden the pain felt from the vigorous uterine contractions. This now concludes this presentation on the introduction to the nervous system.